Wow, wow, wow. We are live. Good morning, good afternoon, good evening, everyone. Depending on where you're joining us from tonight. You are welcome. You're welcome. You're welcome. Good evening, everyone. Please confirm if you can hear me.
Yes, I can hear you.
All right, you're welcome. Good evening. Thanks for joining me tonight. Okay, let's see if so we'll be starting right away. Okay, let me confirm that we are live. Great, great, great. Okay, so you can see me clearly, right? So if you're joining us, we would like you to drop your location in the comment section. Depending on where you're joining us from, we would like to meet you tonight. It's such a pleasure to have you. Welcome to CS Mom's Stories. It's a live session, and we're going to be having amazing moms share their story with us tonight. And it promises to be a very interesting conversation. And I would just like you to hang on and ask your questions at the end of at the end of the stories when each of them finish sharing their stories. So but before we begin, if you're meeting me for the first time, my name is Dr. Shamsia, but I'm popularly known as Dr. Shams, the physio doctor, right? And on behalf of her well-being and care community, I am honored to welcome you all to this very special evening. Thank you, and I'm happy to have you all tonight. So this is April, and we are celebrating Cesarean Section Awareness Month, and we thought that the best way to celebrate this month is by giving the microphone to the women who have lived it, right? You see, in Nigeria, whether in any part of Africa, in Ghana, in Kenya, across the beautiful continent of Africa, there is this popular silence that surrounds the CS experience. And you have a baby, everyone rushes to greet the child. They ask, oh, is it a boy, is it a girl? That excitement is there. Some bring food, some bring their gifts, and then nobody actually asks, like nobody literally asks, how is mama doing, how is she coping, how is the pain, how is she recovering from this life-changing experience, right? Nobody really asks why and how she's doing. Months later, they just expect you to go back to your normal activities, be the super mom that you are, and all of that. So, in many of our communities, right, a C section is either treated like something shameful because, well, if you're a Christian, I'm a Christian, so they'll say, you should give birth like the Hebrew woman, So, in our society, giving birth through vagina seems to be the definition of a strong woman. So, however, the world is changing, civilization is setting in, and the paradigm is shifting. So, it's important that people are enlightened to know that, well, the world has changed, times and seasons have happened, right? And so it's important that people actually get to know, be more informed that when a woman doesn't give birth through vaginal birth, it doesn't make her less of a woman. And that's why we're having this important conversation tonight. um the healing of our moms matters, and their stories are very important. So tonight we're going to be hearing from super amazing moms, right? We're going to be hearing from them, and they're going to be sharing their stories with us, their experiences. Some of them have had 1 year's experience, some two, some even three. So we can see that it's not a joke at all, and it's not a walk in the park, right? So joining me tonight on stage is the amazing mom Temidayo. The amazing mom Temidayo. She's a serial entrepreneur. She's very passionate about growth, learning, and impact. And she's a beautiful mom of two girls. You're welcome. You're welcome, Mommy Temidayo. Welcome on stage with me. And then we have mom, the amazing mom Ibu Oluwa Obaje. You're welcome, ma. She is a banking professional with over 6 years in client experience and relationship management. She has an MBA and a beautiful mom of two boys and a girl. She currently works with, a banking sector. So thank you so much. We're excited to have you, Mama. Welcome, welcome, welcome. You're welcome on stage with us. You are welcome. So yes, we also have Mama Taiwo. She'll be joining us shortly. She sent a message. She'll be joining us shortly. So we have amazing Mom Taiwo. She's a seasoned nurse, midwife, and a pregnancy coach with over 10 years of experience in maternal and child health. She's the founder of a virtual antenatal class with Taiwo, and she empowers women with practical knowledge for safe pregnancy, childbirth, and beyond. We're excited to have you join us, Mom Taiwo, into this interesting conversation. All right, we'll be getting into the conversation right away. Okay, so can you hear me, Madam Temidayo?
Yes, I can hear you. Good evening, Dr. Shams.
You're welcome. You're welcome. Thank you so much. I'm so excited to have you with me on stage in
Same
this very
here.
interesting conversation. All right. So I'll be starting with you. I'd like you to just briefly share with us what your pregnancy journey has been. We understand that you're a mom of two beautiful girls. So we want to know how your experience has been being being a mom of two, and you've had a cesarean section in one of those pregnancy journeys. So, but before we go into the main story, kindly tell us in a few minutes what your pregnancy journey has been. Thank you.
Okay, thank you so much, Dr. Shams, for this opportunity. Good evening, ma'am Eboluwa. Nice to meet you. Okay, so thanks for the opportunity to share my story with everyone. So for my pregnancies, okay, my first pregnancy was a C-section, and then the second one was a VBAC. That's vaginal birth after cesarean section. I would say my pregnancies have been very smooth. Really, I really do not encounter much challenges during my pregnancies, except for my first one where I didn't really exercise much. And I think that impacted when I wanted to deliver. So during the whole labor process and everything. But generally, pregnancy for me has always been very smooth. So, and during my second pregnancy, I got to do more exercises, and that showed at the point of delivery. So the only difference between the two pregnancies was that I took exercise seriously in my second pregnancy,
Wow.
as against my first pregnancy where I didn't really do much exercising. But generally, my body is very, in fact, you wouldn't even notice changes on my body, unlike some people, some women, sorry to say. But for me, you wouldn't really notice much except the tummy itself. But I didn't really experience any form of challenges during pregnancy. During my two pregnancies, they were smooth to the glory of God. Thank you.
Amazing, amazing, amazing. Do you know what I love most about what you said about your pregnancy experience? Is the fact that you actually exercised in your second pregnancy and you didn't exercise in your first pregnancy. So you saw the clear difference. In fact, the message has started already tonight. So if you're a mother who is intending, or a woman who is intending to be pregnant anytime soon or to have a baby, you can see that exercise during pregnancy plays a very, very significant role during pregnancy, right? You can see what Mrs. Temidayo said. She said during her second pregnancy, she had it almost smoothly because she actually engaged in exercise. So we should not trivialize exercise during pregnancy. It's very, very important. All right. Thank you so much for sharing your experience. Okay. Madam Ebun Olua, is she with us? Can you hear me? All right, so we can just go ahead before Madam Eboluwa joins us back into the conversation. So, Mrs. Temida, I would like you to share with us, at what point did you realize that you might have a cesarean section?
At the point of labor, I'd labored for like 24 hours, if I'm correct, and I wasn't progressing, I wasn't dilating. So that was when they said there was need for an emergency C section because the baby was already going into distress. So yeah,
Okay.
that was it. So it wasn't planned.
Okay. Wow, wow. Madam Eboluwa is back on into the call, and we would like to, share what her experience was like during her pregnancy. Madam Eboluwa, please, would like you to share what your pregnancies are. We believe that you're a mom of three, and you've had three beautiful experiences of childbirth. So we would like you to share with us what your experience was like. Thank you.
All right. Good evening, Dr. Shams. Good evening, Mama. Yes, I'm a mom of three. I have two boys and a girl, and I've had three cesarean section. So for my first pregnancy, it was quite smooth. The only issue was I had sometimes high blood pressure. So sometimes I'll go to the hospital, and when they check my BP, it was always around the range of 140/90 or 150/90. So because of this, at my 40th week appointment, I was asked to go for a membrane sweep and then to come in the next day for an induction. Hi, Dr. Sharma, are you still there?
Yes, I'm with you. Can you hear me? Hello? Can you hear me?
Hello, Dr. Sham.
Yes, I'm with you. Can you hear me?
I can't really hear you, so I don't know if you're muted, but I can't hear you.
I can hear you. Can you hear me? Oh, I'm not muted. Can you hear me?
I
Maybe
think
it's
you're muted, Dr. Sham.
no, I'm not. Can you hear me?
I still think you're muted.
Can you hear me? I'm not muted. Can you hear me now?
Okay, so just to confirm, Mama Tammy, can you hear me?
Yes, I can hear you.
Okay, so Dr. Sham, I think you're muted because I can't hear anything from my end here.
I'm not
Can you hear
muted.
me?
Can you hear
I
me?
can actually hear her.
Okay, but
So I
I
think,
can't hear her.
all right, just go on.
Oh, okay, I can hear you now.
Oh, excellent. Sorry, maybe that was a network hitch. Okay, please go on.
Okay, so I was scheduled for an induction at 40 weeks. I went in the morning of the induction routinely because I was having an issue of high blood pressure. So the first thing they did was to check my blood pressure as at that point in time. And as usual, it was charting 150, 100. So I don't know if
Mm.
it's because I was scared or that was just my blood pressure at that point in time. And then the
Was
next
this
thing
your
they
first
did.
pregnancy?
No, this was for my first pregnancy.
Oh, okay, beautiful.
Okay. So after that, the next thing that they did was just to check the baby's heartbeat, just to be sure that everything was okay before we proceeded with the induction. And it was fine. Everything was fine. I got hooked up to oxytocin and the induction started. But 1 hour into the induction, they came back to check the baby's heartbeat and they noticed that the heartbeat started dropping. So they were unable to increase the dosage of oxytocin that was being given to me. Um, Basically, they were unable to do a lot. They just kept on saying that they were going to try and monitor to see if my cervix would dilate on its own, and that if it doesn't by the next day, then I will be wheeled into the theater for an emergency C-section. So
Mm.
occasionally they will come and check, and they'll see that I'm still like a fingertip dilated, and I've made no real progress. So by the next morning, the surgeon was contacted and a C-section was done. In the process of the C-section, we noticed that why my baby was in distress was because he had passed his first poop already.
Oh.
Yes. So they brought the baby out. It took a while, but he cried eventually. And that was it. During the process of my cesarean section, so my cesarean section is usually done using spinal anesthesia. Um,
Mm.
the first thing I usually notice is, or I usually complain of, is like there's this. Would I really call it chest pain? I just noticed that I just noticed that towards the end of the cesarean section, I would have this chest pain that I would complain about, and the anesthesiologist would just tell me it's fine, he will handle it. And he would administer something to me. I really don't know what, but he would administer something and I'll feel better.
Okay.
Um, Recovery wise, my first cesarean section was the easiest to
No,
me.
you're already
Like,
taking us so far. You're already taking us so far. We're getting there right on time.
okay,
Yeah.
so you can ask your question so I can answer.
All right. That's great. Such a wonderful pregnancy journey you've had. You know, every pregnancy is unique, right? Not every one pregnancy cannot be the same with another pregnancy. So I'm glad that you've actually had three different experiences in pregnancy. And then I would like to know at what point, with maybe your first, second, I think you said it was your first pregnant. Okay, you had cesarean section throughout all your three pregnancies. Was there any one of them that was by choice, or they were
Okay,
all emergency?
none was by choice. Okay, for the
Oh.
second one, because the duration of my last pregnancy and the second pregnancy was a bit closed, I was advised to go for a planned cesarean section, which was what I did. But
Okay.
for my daughter, there was a 5 years, almost 6 years gap. So I was hoping maybe I would be able to try, but not a lot of Nigerian hospitals would allow you to try it for a VBEC
No,
after
birth.
two
Yes,
cesarean sections. So
absolutely, absolutely. Yeah, we can hear you.
so I was advised to go for another cesarean section again, which was what I did eventually.
Okay, okay, that's interesting. All right, over to you, Mrs. Temidayo. Would like to know how your C-section experience was. You said you had your first baby through an emergency cesarean session. So, would like to know how was the experience for you? being that it was an emergency, so obviously you didn't plan for it. So
Hmm.
could you tell us how it was? What was the experience like? Over to you.
Okay, it was, it was unplanned. I was already in so much pain, and they said, okay, this is what we have to do. And yes, I was given the anesthesia, and the procedure was carried out. And
Hmm.
then I was wheeled out of the theater to the recovery room. But then I realized they said, oh, you can't lift your head. The anesthesia needs to wear off. You can't eat anything yet. You have to monitor your system to ensure that you you pass out gas. I think it's after you've passed out gas before you'll be allowed to eat anything. So it was a lot. There was so much pain. I couldn't move my body. It was just different because I had never been under the knife before. I had never passed through that kind of process before. It was something else for me. And even at that point, because I had passed through labor and then this one, I didn't really even want to touch my baby at that point. You get, it's not because I was upset or my body system was just not accepting my reality at the time. Yeah, so that was it. I had to spend like how many days in the hospital in
I can
pain.
imagine.
Yes, I had to
Hmm.
start. They said, "Oh, you need to start to walk again. You need to stand up and walk. It will aid in fast recovery and all of
Hmm.
that. It will aid and ensure that your recovery is fast enough. So you have to walk with the pain. It was a lot. I was like, God, but really, I'm glad that I'm able to share the experience. But I don't think I would like to pass through it again. It's not bad though. I'm not trying to demonize it because of course they needed to save mother and child. But because
Yeah.
of the pain that came afterwards, of course during the
So
procedure you won't feel the pain, but afterwards the pain that comes with the whole thing is not easy.
wow. Yes, I get you. Absolutely. So, Madam Temidayo, are you trying to tell us that a vaginal birth is easier than a cesarean birth? Because you say you
Hmm.
wouldn't like to pass through the experience of going through the knife anymore. So, are you saying that a vaginal birth is quite easier?
Oh my god.
That
Now
it's
why do
just
you want to
like
put
going
me?
after baby?
Ugh, both have their own pros and cons. That's one thing we should understand.
Mm-hmm.
Um, the pain for the vaginal birth is at that point, and then
Mm.
afterward. But then for me, I even had an episiotomy.
Oh,
I
oh,
had an episiotomy for my vaginal birth, so I still had some pain to deal with. That one, the recovery process is quite fast and all of that. So none is both of them have their pros and cons. That's what I would say. So
yeah, yeah. For the
yeah.
sake of our audience who may not really understand what episiotomy is, so it's actually a surgical cut that is done by either the midwife or the personnel that is receiving the baby in order to give room, for the baby's head to pass through. So that alone is actually it causes a lot of problem to a woman who gives birth through vagina, and actually has an episiotomy. So just like Mrs. Temidaya said, there is no easier route. The truth is whether through the cesarean section or through the VBAT, really it's there is no easy route. So yeah, thank you so much, Madam Temidayo, for sharing your experience as both a cesarean section mother and a mother who has given birth through her vagina. All right, amazing mom Tayo is with us. Welcome, mom. Welcome, welcome, welcome. Thank you so much for joining us on stage tonight to share your amazing experience as a C-section mother. Could you say a word to us? Although we've gone into the conversation, but we would just like to hear from you. How you doing this evening, and how was your pregnancy journey like? Being a mom of one amazing daughter. Can you hear me?
Yeah, good evening, everyone. Please, I don't know, can you come again because it was breaking? Thank
Oh,
you.
sorry. Maybe your network. Can you hear me now?
Yes, loud and clear, I can.
All right, you're welcome. You're welcome.
Thank
Thank you
you.
so much for coming to share your amazing cesarean section journey and story with us. So, I said we've gone a little bit into the conversation, but we wouldn't want to keep you behind. So, we just want to catch up with you as well, right? So, please,
Okay.
could you share what's your pregnancy journey like? You're a mom of one. How was your experience like? And that first pregnancy, you actually had a cesarean birth, right? So we'd just like
Yeah.
to know, how was your pregnancy journey like before you even had the cesarean section? And leading into the cesarean section, was it a planned cesarean section, or it was, by choice? Over to you, ma'am.
All right, thank you very much. So
You're
please just give me
welcome.
some minutes.
Okay.
So thank you so much. I'm back. So for the question, anyway, my pregnancy journey was okay. No
Mm,
complications, nothing. It went well actually.
amazing.
Then the cesarean section was not planned. Yes, it was not planned. It was an emergency cesarean section. And I would tell you that I had labored, like, would I say for hours? Yes.
Mm,
Because if not that the labor did not progress well, as a midwife, I would have called it a kind of precipitate labor, like fast labor. Because during the pregnancy, I was fine, and I could remember I went for antenatal clinic that day, and
mm,
due to the distance of my home to the hospital where I booked, and when they examined me, they saw that I might fall into labor soon because the bishop's score was very okay. So I'm sorry, I'm using some medical terms. I'm sorry about that. So I voluntarily said I'm going to stay back, right? So while
mm,
in the antenatal ward, I was fine until I could remember that at a particular point I felt like I wanted to vomit, and
mm.
after vomiting, labor started. Like the pain was intense because even me myself, I wasn't believing that I'm in labor. But because of the frequency of the contraction, I know that this labor is fast. And when it was becoming frequent, I understand what it means. I walk up to the midwife to check me.
Okay.
And when he checked, he said I'm fully dilated. And I was moved to the second stage room. And I won't lie to you, I was there for hours, fully
Mm,
dilated. But because of some, let me say, my presentation, baby did not descend. And after so many trying and the likes, I was moved to the theater, and that was how I had my baby. The joyful thing is that there is a live mother and a live
mm.
baby. And that is the joy of motherhood, right? And that is the positive outcome of pregnancy that everybody is expecting, irrespective of whether it's vaginal birth or it's natural birth, any form of birth, as far as there is a LD mother being alive. There's a difference in for the
Absolutely.
mother to be alive and having a part of her body affected,
Mm.
and there's another thing for the baby to be alive and for the baby not to be fully, I don't know, I don't know how to put that
I
one.
get you. I get you.
Yeah. So whether it's natural birth, sorry, I don't want to use the word natural, whether it's vaginal birth or it is cesarean section birth, as far as
Mm.
mother and baby are alive and well, I think um I would say that I have a wonderful pregnancy and delivery journey. Thank you.
Amazing, amazing. Thank you so much, Madam Tayo, for sharing your story with us. While you were talking, it just made me to remember, um, as a physiotherapist, practicing, I've encountered babies. I don't know if some of you would have heard about such conditions. It's very common, cerebral palsy. And we know that cerebral palsy is mainly as a result of complications during childbirth. Now, I always tell people it's not just about having a successful childbirth, but mother and child coming out of that process successfully is such a big deal. Because in a situation whereby the mother is in distress, the mother is actually having a long labor, the child goes into distress, which can actually affect the child right at that process of giving birth. And it will now, in turn, affect the brain of the baby, leading to permanent damage of the baby's brain, which leads to condition like cerebral palsy. So I get what you mean when you're saying that it's actually best, regardless of whether through cesarean section or through vaginal birth, what is most important is the outcome of the mother and the outcome of the child, right? And if we see there's just a similarity in all of our experiences, each and every one of us actually had it through emergency cesarean section. That's to tell us that a number of women don't even actually have cesarean section by choice. And it's so interesting to know that statistics tells us that a number of women, the rise in cesarean section is actually increasing, and most of them is largely as a result of complications that arise during childbirth, just like what Madam Taiwo was talking about. She was not progressing in labor and it wasn't just forthcoming, so they had to advise an emergency cesarean session. Similar with Mrs. Temidayo, you understand, she wasn't also progressing in her labor, and in order to save her life and the life of her baby, they advised what an emergency cesarean session. All right, so we're going to go into the recovery journey. I know that since some of us have actually gone through the vaginal birth, and then some of us it's just entirely cesarean section. I'll be starting with Madam Ebolua. Please, I'd like you to tell us what was your recovery journey like as a C-section mom of three, like you had gone under the knife three good times, and each of those journey, I'm sure, were unique and different in their own ways. So we'd like to hear from you. How was your recovery journey like? Over to you, ma'am. Can you hear me?
Yes, I can. I can hear you.
All right, thank you.
Let me, mommy, mommy. Sorry, I.
I understood.
Okay, so for me, the three cesarean sections were really different in terms of recovery. I would
Mm,
say the first cesarean section was the easiest to recover from.
mm,
I was up and standing by day 2. I was taking a couple of steps. Usually for me, in all the three cesarean sections, I would usually pass gas that very day of my surgery. So maybe a couple of hours after surgery, I'll pass gas, which means that the very next day, when my doctor comes for ward round, usually they would say I can take lifting just a few sips. Um, my second cesarean section, I experienced, I don't know if it's my uterus that was contracting back and I was feeling the pain this time because I didn't feel it in the first cesarean section, but this time it was very pronounced. Like after my surgery, I remember I kept on saying that I was in a lot of pain, and the
mm,
nurses came, they administered the pain med that was available to me. And after a couple of minutes, I still kept on saying that I was in pain. Because the
Mm,
first time around, after they wheeled me out from the theater, I started sleeping. In short, for people that were coming to visit me, I remember I wake up and tell my mom that people are disturbing me. Oh, me, I want to sleep. Your voices are disturbing me. But this
mm,
other time around, there was nothing like I would want to sleep. I was in pain. It was
oh,
painful.
oh,
So I did not understand why I was in that much pain, but it was a painful experience. Then, unlike the first time, to stand up on the bed the second time around was a whole lot of work. Apart from the nurse that was assisting me, my mom also had to come and assist me. It felt like my internal organs were about to fall to the ground. In short, I felt like somebody cut me into two.
mm.
Felt like someone cut me into two. And then when I go home, I had to take it really easy. Picking up my son from the bed was a lot of work and all. So I felt that maybe after a while, if I gave myself a long time to heal, which was what I did with my third pregnancy, I felt like if I gave myself a long time to heal.
Mm. Hello, ma'am. We lost you a bit. Hello, ma'am. Can you hear me? All right. It seems we've lost her. Maybe her network. Hello, Madam Ibolua. Can you hear us? Can you hear me? Okay. All right. So maybe her network fluctuated. Okay, so before Mother Ibolua continues with her story, her recovery journey, I can imagine what it means like to go through cesarean section three good times, right? And the journey is definitely different. And being that you went through anesthesia, she said she was just feeling very sleepy. I wanted to tease her that, are you sure, mom, that it's not you were not still under the influence of anesthesia? So yeah, it happens, right? There are different things that can come up. And another experience, she talked about how she was really feeling pains. So I would say that cesarean section is actually pain after victory, right? But vaginal birth is actually victory after pain. So that's how we are going to like let's say
Hi,
explain it. Oh yeah, she's back. Madai Bolua, can you
sir.
hear?
Yes, I can hear you. Sorry, my network is really not good this night.
Oh, sorry. We
Okay, let
understand
me
very
just
much.
quickly talk about my third cesarean section. Okay, so I experienced something I've not experienced in the past two cesarean section, which was constipation. I've
Mm,
heard about it, but I didn't think it was a big deal until I experienced it. It was
mm,
not funny at all. Like, um before I left the hospital, I could pass stool, but I noticed that when I got home, it was very difficult to pass stool and also
mm,
to urinate. I even had to go back to the hospital to complain, and the doctors gave me like stool softener to assist with the constipation and all. So that was
mm.
something that was very different from my two previous cesarean section.
Oh, wow. Yeah, it happens. Just like I was saying, that there are different things that can actually occur as a result of childbirth. So, but I hope you didn't put so much strain because, and that's one thing. So, as a physiotherapist who works with women after delivery, we help to train women how to actually assume positions that will not put strain on the scar, on the incision line, so that it does not cause further complications. Because I've heard of women who, after their first cesarean section, they had to go back into the theater because of complications. Some of them, their incision line got ruptured. Some of them started having pulse come out of that incision line, and infection setting. They had to be taken into the theater. So many stories. So I hope that you were not putting strain on yourself and you didn't really have any further complication after, the constipation. Because you are advised, I don't know if it's peculiar to just me, but generally after a cesarean section, how many of us experience that you're told not to eat anything, you can't take water, you can't take anything until you have your first fat. Who had that experience?
I think that's the norm in Nigeria. You have to pass gas before you can take
Yes,
anything.
yes, yes. So you have to pass out gas before you're actually permitted to take anything, even water. So how long did it take you before you actually passed your first gas in this last experience, Mother Ebo Lua?
That very day, like maybe 2 hours after the cesarean section, it was very fast.
Okay. So yeah, because you so how long did you now eat afterwards? Because I know you start with fluid gradually before you maybe take something solid on the second or third day. So at what point did you notice the constipation that you were feeling?
So it was when I got home and I was eating amala and every other thing. That's when I started getting constipated.
Oh my god, okay. Yeah, so that was after your discharge from the hospital.
Yes.
Oh, okay. Yeah. So it's your fault. You're not supposed to start eating amala, for God's sake. You're supposed to be
But the
taking
doctor said
foods
I
that have
could. He
high
said I could.
fiber.
He said I could eat amala. He just said in moderation.
Okay. All right, that's fine. But generally, after a cesarean birth, we're expected to actually take foods that are rich in fiber so that we wouldn't have issues like constipation, especially in our subsequent pregnancies. Please, let's just take that to heart and also be cautious so that the essence of this discussion is actually to learn from our experiences, and for those who are also going to pass through the journey, they don't have to make the same mistakes that we pass through. So it should be a better experience for them as well. All right, that's great. So over to you, Madam Taiwo. Being that you've had a cesarean section once, how was your recovery like? How's your recovery journey after a cesarean section like? Madam Taiwo, can you hear me?
Okay. Yes,
All right. Did
so
you
my
also experience
journey.
constipation?
No, not at all. Not at
Okay.
all.
So,
If I started standing up second day, and I think
mm,
my bowel sound resumed, I think the second day too. So I started with oral sieves and the likes. I was cautious because of I've seen when patients don't cooperate. Like she said, now I've seen patients that has constipation, so I was so conscious of that. So I had a very, in
mm,
fact, people did not know that I had CS. People that came to meet me, they didn't know that it was CS. So you won't
mm,
know that I had CS. So my recovery process was very good. I won't lie to
hmm.
you.
Madam Taiwo, you have to tell us what's the secret? What did you do differently? Because there must be a secret. There must be something. Being
Well,
a seasoned midwife, for such a number of years. Is there any secret you want to tell us that we should know to
and
actually have a smooth
well,
recovery after
there's not really
after
any secret actually, just God. Is God
Oh.
actually, because okay, let's say because I've had one surgery before, a minor surgery, appendectomy, and I know what to expect. So I know that the pain is, if as long as I'm giving my pain medication, I'll be fine. So okay, maybe I was having pain and I see it as normal, because if a razor cut your hand, you feel pain. So not talk of knife cutting how many layers. So definitely I know that I'll feel pain. So maybe because I already know the pain will be there, but with painkillers, it's going to be reduced. Probably that's why I was able to cope, right?
Okay.
Maybe.
Yeah, and that's what, yes, I need to bring this to our attention. Yes, we know that when we pass through this process, pain is inevitable, but there is a level of pain that you should not consider as normal. And that's why, physiotherapy after childbirth is very important. It's not very common in this part of the world. However, it's very important because what your physiotherapist will help you do is to actually use modalities that will help you reduce the pain. Imagine if you're supposed to actually experience a pain of, let's say, 89%. If the therapist can help you bring that pain up to the level of 20%. So you can see that the level of pain will actually be different and the experience will be different. And unfortunately, in Africa, and especially Nigeria, we've been giving this mentality that, okay, oh, pain is normal. Pain is not normal. Pain is inevitable, yes, but it can actually be reduced. It can be mitigated. So if there are measures, if there are things that you can do to actually reduce that experience, that painful experience, then I think it's important that we should explore it and also encourage other people who will also go through this process to actually, explore measures where they can actually have reduced pain and have enhanced cesarean section recovery. Yeah, so I would like to ask us, in all of this journey that you've had so far, from your pregnancy journey up to having a cesarean birth to your recovery, which aspect of this journey would you consider the hardest part? Is it the pregnancy? Is it the childbirth? Is it the after childbirth process? So yes, let's start with Mrs. Temidayo. Which aspect of your journey entirely of being a beautiful mom of two would you say have been the hardest part for you? And how have you been able to manage it so far? Thank you.
Well, how do I put it? None of the process is easy. None of the process is simple, right? For me, I had to labor for a while before I now was taken into the theater. So I experienced both in a way. So
Mm,
my mind was already disoriented. So that part of it was not really a beautiful experience for me. But the
mm,
joy of having my baby in my arms would probably just wipe away all of the pain and everything away. So
yeah.
I wouldn't say all of the process has its own wahala. How do I put it? I won't say the pregnancy journey, the labor, the C-section, the recovery. Like right now, I still have my mommy pouch and I'm still trying to look for ways to bring it down, you know,
Mm,
so that I can slay well. I can wear my dresses because every time for everyone that had a C-section, there's always a mommy pouch. I don't know if I am wrong or I am right, but for me, I have a mommy pouch and I'm trying to see how it can reduce so that I can slay. So that's it for me. I can't
yeah.
say this was sweet, this was not sweet. All of them had their own accompanying baggage that came with it.
Mm,
So
mm.
that's it.
I mean, being a mother is not easy. And even in the middle of those experiences, you still have to be a wife, you still have to pursue your career, you still have to, focus on your life, the pain that you're facing. Oh my God. Shout out to every amazing woman out there, to every amazing mom. We are heroes. We are doing so much at the same time. And we thank God for grace that has really helped us to navigate through all of those processes. So yeah, emergency is not something that anyone plans for. And for Mrs. Temidayo, in fact, that came to her as a shock because I'm sure she was expecting that she was going to give birth by herself. But situation happened and she had to have her emergency session. But well, nevertheless, she's coping. She coped well, and she said she's still, dealing with mommy pouch. Yeah, so we have C-section, mommy pouch. So is common among women who has actually undergone cesarean section. These are one of the physical impacts that cesarean section has on a woman. I don't know, Mother Tara and Mother Ebolua, can you concur to that? Did you also experience mommy pouch? That's the overhanging tummy in which your stomach is hanging over your C-section incision, over the scar. Is it something that's
Yes.
common? All right. Yeah. So, and that's why, yeah, you guys have me, you have other physiotherapists in the society. That's why the truth is, I was doing a teaching the other day and I said, there's no amount of herb, there's no amount of, they call it gido, right? In the local context or in the Nigerian context, that okay, where your gido and all of that, or some people use tummy belts. So all of those things can actually provide support, but it's not going to give you a lasting solution. And that's why you need to have tailored exercises that will help strengthen your core, because the definition of your mommy pouch is just crying to you and telling you that my muscles are weak, help me, help me. That's what that tummy is trying to tell you. So if you do not address the core of it, that is trying to strengthen those muscles that have become weak, it might just be, a journey in fertility, and you just keep wishing and wishing and wishing, and at the end of the day you may not really get the kind of result you have. So yes, it's very important to actually enroll in postpartum exercises. Yeah, so I have a course related to that. If you're interested, if you want to enroll in our postpartum classes, whether you're a mom here or you're listening to us in the audience, yeah, this is something that will really help you, especially if you know you're done having your babies. Because as I interact with women, they'll tell you, just leave that one. I'll still go through the process again. So let me finish giving birth to my children. By the time I finish giving birth to my children, I'll now focus on my body, right? And get back to my almost pregnancy stage, because you can't go back to how you were before pregnancy. Pregnancy is such a huge game changer for any woman. Yeah, so Madam Ebolua, I'd like to know, in all of those processes, in all of those experience that you've had as a three times cesarean section mom, please could you share with us which of this process was the hardest for you, and how were you able to, go through this process? Are you still recovering from it? Have you recovered from it? And what exactly did you do? Please share with us. Thank you.
Okay. I'm not sure any of them was easy. The
Mm-hmm.
pregnancy as itself, the cesarean section, the recovery. But for my first cesarean section, I like to spotlight the recovery, right, and then the care of a newborn. So I feel like there is really no much information regarding breastfeeding and taking care of a newborn, because when I had my son, breastfeeding was very difficult for both of us. Like, he couldn't latch properly. The few times that he would latch were very painful to me. I experienced cracked nipples, and to the fact that there were ways that he could have latched better. I would have, if probably there were informations available, I would have noticed that he had tongue tie. That
Mm,
I didn't notice till when he was 6 months. I just
that's
noticed that whenever he cried, there was something I was seeing that I really didn't understand. So I took him to the hospital and just pointed it out. And the matron just casually told me that he had tongue tie, but he has been coming to that same hospital from the very first day that he came into the ward, and nobody noticed he had tongue tie. So our breastfeeding journey was all over the place. Eventually, I really wanted to exclusively breastfeed him, but because he couldn't latch properly, we had to supplement with formula and
mm, I can imagine. Adebola, seems her network has cut her off again. Can you
What?
hear me?
Can you hear me?
All right, yeah, you're back. We lost you for some minutes.
Okay, what about now?
Yeah, we can hear you loud and clear.
Okay. So I was just talking about things that I probably would have noticed if I was more experienced or if there were more informations available. But subsequent delivery, I knew about tongue tie, and breastfeeding was more easier for both me and my kids. So for the first cesarean section, the after the cesarean section was the biggest difficulty for me. Taking care of a newborn. I don't know how other first time mom do it, but it was like how it was. I was in a world of my own. I was used to sleeping and waking up anytime I felt like waking up. But this one, I'm
Mm,
waking up every 30 minutes, every 1 hour to take care of a crying child. I wasn't
mm,
sleeping well. There was a particular time that I was very sure I had postpartum depression because I was just unusually sad. So
mm,
it was just a lot. But
mm.
subsequent delivery, I ensured that I had adequate help. I had people around
Okay.
me at every point in time. My mom was available, my mother in law was available, my cousins will pitch in once in a while. So it was way easier.
Amazing. You see, that's why we cannot overemphasize the importance of support system during pregnancy and even after childbirth. During that recovery process, we just want to get all the support in the world that is available onto us. I'm so happy. I'm sorry about your experience, your first experience. That these things they don't have what's it called, there is no template, there is nobody preparing you for pregnancy, like okay, these are things to expect, and most times we just enter into the experience whichever way it comes for you, and then you just have to take it that way. And so that's why we're trying to change this trajectory, this experience for a lot of moms, making them understand that they can actually do better, they can actually have a better experience. And I just pray that maybe in your future pregnancies you won't have to
No,
experience that, because and that's one thing. Oh, are you done? Are you done? Yeah, so that's it. So experience just has a
no
way of
future
reshaping.
pregnancies again.
You never know, you never can tell. Anyways, yeah, so whichever the case may be, experience just have a way of shaping us and making us to know better and to act better. So yeah, thank you so much for sharing such a wonderful part of your journey with us. Yeah, over to you, Madam Taiwo. Please, could you share with us, being a one-time C-section mom, what was your hardest part of that journey?
Hmm. Great question. My hardest part of that journey, well, can I really remember any for now? Or would I really want to share that online right now? But then thank God for support system. Anyway, like she has said, thank God for
Hmm,
support system, and thank God for my partner who was very, very supportive. That time
amazing.
I lost my
Wow, wow,
mother-in-law.
wow.
It was a kind of something that, and but thank God for support system. That's just all I can say. That's all I can
Hmm,
say. I was having an exam because I was rounding up with my degree. So I was paying for exam, like I had the exam 2 weeks after, and I don't want to miss that exam. So imagine
hmm.
myself traveling from Ogun State to Osun State to go and write exam with 2 weeks baby. And I told you that I labored like for hours before the
Yeah,
emergency stay was done. And because of that, I was having a kind of I was scared of, when you have knowledge of something, you'll be thinking about it. I don't know if you know, okay, you will know now, you're a
yeah,
physiotherapist. Drop foot.
yes,
So
yes.
because I labored for long, I was already having a kind of, I don't know, I
Hmm.
wasn't able to walk well. I won't lie to
Maternal
you.
obstetric palsy.
I was telling my friends, I would say, am I walking well? They would say, don't worry, you're fine. But then I know that I'm not.
You
That's
knew
why
that something was off.
imagine carrying a 2 weeks old baby to write exam with me having to leave. Even though they are trying to, I know they were lying to me. They don't want me to feel bad that I'm working well, but I know that my my dates is not too good. So, but I thank God for support from friends, from family, from especially from my husband. He was so supportive and he made the journey to be easy. Thank you.
Shout out to him, Mr. Adesuyin. Shout out to you, sir. And to every
Thank you.
amazing and intentional husband out there, we see you, we celebrate you. Thank you so much for supporting your beautiful wives. We are happy that, such men still exist in our society. Yeah, so thank you so much, Madam Taiwo. We are happy that at least during your experience, you actually had that support system, and it cannot be overemphasized. Men, family, society needs to know that when a woman goes through this very life transforming stages of her life, she needs all the love, all the care, all the support that she can get until she fully recovers. So yeah, we celebrate every intentional man out there, every intentional husband, family, mother-in-law. Thank you so, so much. Thank you for your support. Thank you, and we appreciate you. We see you, and we love you for all the good things that you do, and for everything that you are to our amazing moms. All right, we'll be wrapping up the conversation very soon. So, as we plan to wrap up, when we are looking at the society that we are today, when it comes to cesarean section, unfortunately, in a civilized world like today, some people still have that notion that when a woman gives birth to a cesarean section, it's either she's a lazy mom, is either, she's not a Hebrew woman because you're expected to give birth like the Hebrew women. Well, society is changing, and just like I said earlier, statistics shows that there is a rise of cesarean section, among women because of complications that is setting in during pregnancy. And so we'd like to know, looking at the societal perspective, in your journey so far as a cesarean section mom, did you experience any form of maybe stigma, thinking of maybe having this notion of not being enough, maybe not even society, maybe yourself? You understand? Maybe it was just you yourself trying to just think that, oh, I would have, I felt I would have really given birth through vaginal birth, having some kind of feeling. Did you pass through any form of mental issues? There's what we call postpartum depression, right? Just like Madam Taiwo said, navigating, imagine she had an exam and she had a 2 weeks old baby and she had to travel and she had a cesarean section. You can imagine the emotional toll it would have been on her. And then just imagine she didn't even have the support system she had at that time. It would have really been a very, very emotional and terrible experience for us. So I'll just like to know in 1 minute, as mothers throughout this experience, is there any maybe societal influence or experience you had negatively being a C-section mom that you would like to actually debunk and really like to change that perception, to tell the society, to tell our audience today that no, women should not be perceived this way after a cesarean birth based on your experience? All right, so we'll be starting with Madam Temidayo. What would you have to say when it comes to cesarean birth and societal perspectives and experiences, and how the society views C-section mothers? Thank you.
Okay, I would like to say C-section is not a death sentence because there's this
Mm,
stigma in Africa, in Nigeria, where they would say that, oh, C-section is bad. If it needs to be done to save mother and child, please
mm,
do well. Go ahead, do it. It's not a death sentence. You will not
mm,
die. You'll come out well. Your baby will come out well. Yes, so
mm.
that's my own take on it.
Amazing. Thank you so much. Thank you so much. All right, Mother Ibolua, please let's hear from you. What do you have to tell the society, the audience, concerning societal, perception of C-section mothers?
All right. Just as Madam Taiwo said, C-section is not a lazy woman's way out. It is necessary. And when you are advised to go for a cesarean section, I don't think that's the time for you to start praying that you should deliver like the Hebrew woman or start calling multiple people to come and pray so you deliver. The doctor that
Mm,
gave the verdict knows what he or she is doing. And the reason for the verdict is because he wants to see you and your baby alive at the end. So cesarean section is not the easy way out. And I feel that a lot of people in the society needs to stop asking C-section moms like, what was the reason? Were you too lazy to push? Um,
mm,
I feel
mm.
that that question
That's
always
me.
makes me laugh. It always
Oh
makes me
my.
laugh because I listened to Madam Taiwo say she got to the second stage of labor and her baby did not descend. So
Mm,
pushing is a whole lot of things. It doesn't just mean me shouting, my baby have to descend. If my baby doesn't descend, then there's no way the baby is coming out. So people should stop asking cesarean section mom, were you too lazy to push? I'm not sure a lot of people have actually gone under the knife, because if they've gone under the knife, they would know that C-section is not the easy way out.
absolutely, absolutely. Thank you so much for that perspective. Like, we cannot say it enough. C-section is not the easy way out. It's not a minor surgery, it's a major surgery under the influence of anesthesia, right? So, and a woman's stomach is cut, seven good layers are being cut to get through to the baby. So, it's no joke at all. So, it's never the easy way out. And the society should stop painting this perception that when a woman gives birth through cesarean section, it just means that she's lazy to push. I mean, situation happens from each of our uteruses. Because of medical condition, things that, yeah. Can you hear me?
We can hear you now.
Okay. Can you hear me? All right. Sorry, network issues. Yeah, so that's it. So please, society, we should do better. All right, so let's hear from Madam Taiwo. What would you say concerning cesarean section and societal perspective to C-section mothers?
Thank you. So, as a midwife, I'm going to be talking as a midwife actually.
Mm,
A lot of women still have this misconception about let me not say a lot of women, in fact, a lot of people still have some
mm,
conception about this cesarean section, and I'm glad that you are bringing it up. I do tell women in my antenatal class that delivering like a Hebrew woman, if you are praying that kind of prayer and now they tell you that you are going to be having CS, and you're now praying that I want to deliver like an Hebrew woman, do you really know who an Hebrew woman is? Fine. The thing that Hebrew woman is, they deliver before the midwife came, right? That's a
mm,
definition of it. I'll try to change the perspective. Is a woman that deliver a baby is alive, well, and the baby is also alive and well. That is the definition of Hebrew women. So irrespective of the method of delivery. In the past, you see women going through labor and they will say the woman died while giving birth or the baby died. The woman has given birth to 10 children and none of them are alive. some of them trace it back. If this cesarean section has been in existence since that time, that death could have been prevented. But now
Mm.
that God has given us the wisdom of inventing cesarean section, why don't you receive it so that you yourself will be healthy and the baby will be healthy? The society that are talking about it, if anything should happen to you today, they will talk about it. They will mourn 2 days, 3 days. Everybody else will go back to their normal activity. So why don't you take your own decision yourself? Why I said that a lot of people, I don't know, I just have to say this. Recently, I was conversing with a senior colleague. When I say a senior colleague, I mean a nurse midwife, right?
Mm.
And somehow she was asking me, she asked how I delivered my previous, um, um, how my previous delivery went. So I told her, this thing I'm telling you is just like maybe a week ago. It's not even up to a
Mm.
week. And I told her it was true CS. And to my surprise, she said, "Ẹ̀yin ọmọ ìsinyìí ọ̀lẹ ni yín." In that's
Mm.
Yoruba. In English, it means that you children of nowadays, you are lazy. I
Oh
looked at
my
her, I said,
God.
I was like, seriously? And we have patients that are there. If you as a midwife, you are saying that,
Mm.
and we are trying to raise awareness that cesarean section is not the end of the world, and you are saying that. So if a patient now, if you now tell a patient that is going to have a cesarean section, say, I'm not a lazy person, no, I want to try, can you imagine? I was trying to tell her that, well, I'm sorry, I'm an advocate of a life delivery, like save mother and save baby, irrespective of the method of delivery. I try to
Mm.
counsel her, if you are doing this, how do you want people that are not even literate to think? You that you are supposed to be telling people about it, you are still the one castigating it. It's not supposed to be. And I think we need to raise more awareness on this, which I'm actually, you know, appreciating you for this great work that you are doing
Mm.
for
Thank
raising this
you. Thank
awareness.
you.
Yeah, one of my clients in my antenatal class, I'm sorry, she reached out to me. She said, where she delivered, her parents, her family are telling her that she should not deliver there because they said in that hospital that they don't waste time, that any little thing, they will just take the woman to the theater. And she doesn't want to have cesarean section. I told her,
Mm.
Madam, you're a first timer. You don't know how your labor will end. If anything
Mm.
happen, they now tell you that you're going to have cesarean section. Are you telling me that you're going to be fighting them, that you don't want to have cesarean section done till something will happen to you or to the baby? What is the joy of carrying pregnancy and at the end of 9 months you are coming out with a child with CP or even a
Mm.
child that is not alive? I when I canceled her, in fact, she had to call the husband, and I think they are baby think of the whole thing. No, yes, if you are not praying for CS, maybe because of the money involved and everything, pray, but prepare. Anything can happen. So cesarean section is not the end of the world. Just see it as God giving us a wisdom, to tackle every situation that has to do with
Absolutely.
delivery. That's
Mm.
just what I want to
Absolutely.
tell everybody. Thank you. Thank you so much for this
Wow,
opportunity.
wow, 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 wow. Thank you, Madam Taiwo. This is such a timely, advice that you're giving to every woman, every mom out there, especially those who are yet to actually go through this process. And sincerely, what you're saying is absolutely right. Like, you'll be amazed that people who are supposed to actually carry this the right information, encourage women about, the recent developments, especially when it comes to medicine, when it comes to healthcare, will actually still be giving women that mindset of, traditional mindset, being that society has changed, civilization has set in, a lot is transforming, and so these are not techniques that are alien, you understand? So it's not something to be ashamed about. It's not something that women should be stigmatized about. Just like I said, from your unique stories, we can see that it was not even by choice. It was medical, need that necessitated that procedure. And I mean, if a woman now has to have it. The best you can do for her is to encourage her, is to support her, is to make her feel as amazing as she should feel. So yeah, thank you so much for those very insightful words. And I believe that this one of the many things that we're trying to do, raising awareness, telling moms that they are the best, they are amazing. And for everyone who has not passed through this process, passing this process is not a death sentence. There are proactive measures that you can take. There are things that you can do that can help you have a better outcome, a better experience, such that even if you have the cesarean section, you can still recover beautifully well and still cope with the circumstance. Yeah, so our conversation is coming to a wrap, right? And I really want to say thank you so, so much to every amazing mom out there, and especially to our community mamas. Like, you are so amazing. You are at the center of my heart. Thank you so much for taking out your time to be vulnerable enough to share your unique experience with us tonight. And it's such a delight. Thank you once again, Mama Temidayo. Thank you, Mama Ebolua. Thank you, Mama Taiwo, for taking out your time to share your story. So I just want you to give one last word to every woman out there who feels less than, who feels that because, oh, I've undergone through a C-section, she's having some body shaming experiences, or maybe a new mom who just even gave birth and is battling with some kind of depression. What is that word of encouragement that you would like to leave her with tonight, and to anyone who will have the opportunity to listen to this session? All right, so Madam Temidayo, one last word from you tonight before we call it a wrap. Can you hear me? Madam Taiwo, can you hear me? So that let me be sure that.
Yes, I can hear you.
All right, so maybe Madam Temidayo's network. So can we hear from one last word from you, Madam Taiwo?
Yeah, one last word to every woman out there. Maybe you are still pregnant and probably they've told you you're going to be having an elective CS, or let's
Mm,
say you had CS done and you're feeling depressed. I just want to tell you that you should not feel less of yourself, because
mm,
cesarean
mm,
section is not a bad thing. Just see it as an intervention to save your life and that of your baby. Just see it as two people traveling to Abuja from their destination, and one takes travel through air, be by air, right? And the other one
mm.
travel by road. You all get to the same destination. So
Absolutely.
irrespective of the means of transportation, so just see the cesarean section like that, that okay, the goal, the aim is to have a live baby and live mother, irrespective of whether vaginal birth or cesarean section birth. All is to have one goal, and that goal is a live baby and a live mother who are both alive and well. Yes, in good state of health. Thank you so much, everyone. Thank you to Madam
Oh.
Shamsia, Dr. Shamsia, if I'm correct.
Yes, you got it right. Thank you so
Thank
much.
you.
Thank you. My name is usually very difficult for people to pronounce, so I'll give you your accolades for pronouncing it well the first time.
Thank you.
Yeah, thank you so, so much. All right. So, in the absence of our other mothers, I'd like to say thank you so much. Okay, Madam Timidayo is back. Madam Timidayo, can you hear me?
Yes, I can hear you. Sorry,
All right.
I had
All
a
right.
network.
Welcome back. Yeah, no
Thank
problem.
you.
One last word from you as we wrap up the conversation.
Okay, do not feel less of yourself as a
Mm,
CF mom. You're not any less than a woman who gave birth through her vagina. It's just
mm.
the process was different. That's all. So, and just take a day at a time in your recovery process. Of course, you won't get that your banging body back, but just like they say, little drops of water make a mighty ocean. So
Mm,
just take it a day at a time and you'll
absolutely.
recover. Yeah.
Yeah, thank you so, so much. Thank you for those encouraging words. Thank you, thank you, thank you, everyone. Thank you for joining me on this very important conversation. And once again, want to say happy CS Awareness Month. It's been such a beautiful and interesting month, learning and relearning about cesarean session. And we wrapped up this month by having this very important conversation, having our amazing moms share their stories with us. Thank you so much. I'm sure our audience, anyone who will get to watch this recording afterwards, will be able to learn something even in their journey, being CS moms. Thank you so much. I really appreciate you all, and thank you. So I'll be ending the live stream. Please do well to have a wonderful rest. Thank you, and bye, everyone.
Bye. Thank
Bye.
Bye.
you.
Thank you.